Good morning, everyone. What a great event so far. Collaboration is such an amazing opportunity to get all these diverse partners together. I'm Krista Livingstone Clark. I'm part of Discovery Community College's leadership team here today. We also have Lois and John McNestry, the president and owner of Discovery Community College here as well. She's also the current president of the BC Career Colleges Association. Over the past 15 years, I have had the fortunate opportunity to wear many different hats. The hat that I love the most is collaborating with partners on direct recruitment for employment. We've had several opportunities to work with employers in healthcare. Speed forward. What's exciting is that it was mentioned earlier, we have 3 sites located directly in retirement concept facilities. That significantly helped starting in 2007 with the massive growth within the private sector care homes. The other neat thing, someone asked about the opportunity to do rural training. I wanted to mention that we've also had opportunity to work with First Nations communities to do very specific training in Ucluelet with New Chandler Tribal Council. We did a healthcare assistant program in partnership with them. We had 90% graduation rate, 100% employment rate. And what was exciting about that was people could train in the community, have supports from their family. It was very successful. We've also had the opportunity to work with the Namgi First Nation in Alert Bay. We delivered a community support worker program there, and the same thing, the graduation rate is very successful. So I would agree with the earlier speakers about that opportunity to tap into First Nation communities. It's a great one. So a little bit about us. Discovery Community College is a private career college which has operated since 1989. We're heading into our 30th anniversary. We have campuses across Vancouver Island and the Lower Mainland, with 6 offering healthcare assistant. We welcome the opportunity to speak today, as the safety of our students, alumni, and the sector they will be joining is extremely important to us. I have been asked to present from the educator's perspective on how we can better collaborate with employers to enhance worker safety, which ultimately will improve retention. So I borrowed a slide from BC Safe, or Safe Care BC, which is based on the 2016 stats, which represented 45% of accident types. Which represented 45% of the accident types came from overexertion. Why that was really important is this is a collaborative project today, and as you heard, I'm the Director of Admissions and Students Finance, so I don't have a lot to do with the training of worker safety. Now, had I talked about collaborating for recruitment, that would have been no problem, but Jeremy stole my thunder. So what I had to do was reach out to all sorts of different trainers in our sector and the employers they work with to find out what's actually happening, what's working, not working, and what we could do to collaborate more in the future. So, some common challenges identified by educators. One was outdated MSIP practice and knowledge. How can that be? We're educators. So some instructors may not be up to date with the latest techniques based on what was taught to them when they were in school. The habits also that they may have developed on the job. One example from a practical nurse educator was that while she was on the job, she was never updated with the latest tips and tricks. Especially when it came to moving people safely. It wasn't a big focus in her training either. Now, she admitted that that was over 25 years ago, and that the focus has definitely changed. So another challenge is bad habits. One of the big problems is that healthcare workers may get away with poor body mechanics when moving patients, residents in bed, or transferring them to a chair, commode, etc., for a period of time until they start to get those insidious aches and pains which become chronic. Or they weaken themselves to a point that just one simple move can give them a major injury. The other thing that was really interesting to me was this lack of awareness. I had feedback from mainland educators, mainland employers, island employers, island educators, and there was a diverse understanding or a lack of awareness when it came to the impression that there was no provincial safe resident handling standard for MSIP. And health authorities, the assumption was, had similar yet different best practices. So that was interesting. Pressure to work faster at the expense of best practices. Students may be trained with the proper techniques, but they aren't supported to use them with mentors at some practice education sites. Students often tend to work at a slower, more methodical pace than that of regular staff member. The proper way initially takes more time until people get used to it, and of course, time is a very precious commodity in healthcare. Students are highly influenced by staff in their chosen field. They feel the pressure to abandon the proper techniques to please the staff, and they are being shown that if they do it incorrectly, right away there may be no immediate physical consequences. So some common challenges identified by employers were around short staffing. We've definitely heard about that so far today. It's been mentioned a few times. So employees calling in sick or no-showing for shifts adds additional workload to staff on site. This in turn causes them to do whatever they can to accommodate all of the needs for the additional clients they are now responsible for. This leads to skipping proper body mechanics, and ultimately the staff member suffers. This also perpetuates the cycle of short staffing, as healthy staff members overexert and end up ill or injured, causing them to cancel shifts, and creates the cycle again. The staff to client ratio was also brought up a few times. Healthcare workers have a limited window of time to accomplish all of the tasks needed for client care. This creates situations where the staff find themselves rushing to provide the care needed and potentially abandoning proper body mechanics. This was also brought up. This was interesting. So financial hardships. We've talked about housing, daycare, cost of living, living wage. Personal financial strain on employees causes workers to overextend themselves. They pick up overtime shifts or work too many days in a row to try and supplement their income. New grads, and we heard about that casual pool, often choose to juggle several casual positions to make ends meet. So they may move from a night shift to a day shift, or with no sleep or rest in between. Again, working tired creates situations where poor body mechanics can happen. Not an expert in this, but I certainly can appreciate it. I've heard some of the speakers today. They say that employers and educators identified some unique challenges. We heard about the slips and trips, the entrance to the home. It's not just what's happening in the home, but one of the main challenges that were identified when talking to people was that the limited resources and equipment in the home can be a challenge. The lifts and other equipment necessary to support their declining mobility while the mobility is declining is definitely a challenge and can lead to trying to modify or make accommodations to help assist people in their mobility. Safe patient handling might also be hampered by cramped quarters and cluttered living spaces. So now to the fun stuff, the suggested solutions. Every problem has like a million solutions, right? And that's what our workshop is for this afternoon. So from the employers and from the educators' perspective, they thought the train the trainer opportunities are coming up through Safe Care BC and other training organizations is an excellent way to make sure that there's a common ground for training students and the expectation of how they're being orientated when joining the employment field. So ensuring educators and instructors across the board receive the best training themselves. An example would be those train-the-trainer workshops, getting clear on what is now considered the most current safe patient handling techniques. Instructors would also need to model these techniques in the practice education setting. Another solution is the universal adoption of the provincial standards for safe patient handling. It's been adopted, but there's not the awareness. Ensure provincial standard document is widely distributed and referenced during the education process, but also during the orientation process. The integration and repetition of proper MSIP practice. Nursing programs, healthcare assistant programs, community support worker programs, they all have MSIP in it. One of the suggestions was to make sure that it's a continuum throughout the training, throughout the lab training, the clinical training, the mentorship by employers, the orientation straight through into employment. Funding to train more carries. That was another solution that employers came up with, and educators. So the BC Care program in 2007 was very successful in moving a large block of people into training. Initiatives of this nature go a long way to close the gap between overwhelming need for care aides in specific communities and the lack of skilled workers. Education and self-care. This is something we can all learn. For many healthcare workers, the hectic pace and a demanding schedule can mean self-care goes to the bottom of the priority list, if it's even on the list. It may seem self-indulgent and selfish to consider your needs and putting yourself first, but consider the direction you're given when you get on a plane. You have to put your oxygen mask on yourself before you can help others, and that's certainly the example that students need to understand as they head out into the health sector. Some educators suggest things like modeling quick mental health or activity breaks while in the program, where they get outside and do something physical or something as simple as daily journaling. Some employers have incorporated stretching for employees before they go onto the floor. Other employers cover costs of gym memberships, provide workshops on relaxation techniques and work-life balance, offering extra services around addictions, anxiety, and depression. On the home care front, a suggestion was to really make sure we're connecting clients with social workers early so that they can educate in the application process necessary for equipment and renovations. It's apparently a lengthy process, so the mobility issues can move faster than the equipment application. So, opportunities for collaboration. As educators, we already form program advisory committees. It's a platform where advisory committees generally talk about in these agendas new curriculum, new practice standards, so there'll be employers, public and private, working with educators for that school's curriculum to kind of bring it to life. What was interesting, I got so much overwhelming feedback on this topic. It was quite amazing, and they actually said, hey, why don't we just bring this up as part of that process? There's usually 1 to 2 meetings a year. It's an excellent opportunity to continue the dialogue. They also suggested cross-organizational training, a way for trainers to facilitate workshops for practice education hosts, but also that way the students are following the same practices right through from schooling to employment. They also mentioned then that the schools could help train the employers and vice versa, just creating this big cycle. They also talked about sharing resources for safety committees, where schools could practice safety committees, potentially have an employer participate, and vice versa, an educator participating in a safety committee in a workplace. Just to make sure those practices and the real life opportunity to explore real issues come up. New graduate mentors. The premise would be to pair a newly graduated student with a seasoned mentor in their new place of employment. The mentor could share the experience with the student, and then the student could also share the best practices they learned in school. So you can see it's just a big cycle. I have to share that originally I put out my request for educators and employers to send in their information about all of the different injury areas. Violence prevention was another big response area. I wish I had more time to share that with you. It was really interesting. So this was directly instructors, program leads, meeting with their practice education partners, along with employers, and the conversation just rolled away. This is just one PN educator who is dialoguing via email to an Island Health employer. She said, facilities supporting student use using proper techniques. This could be the employers talking to the staff prior to the practicum, mentioning the proper techniques is very important to the college, or the college doing demos for the staff prior to the practicum. Then there would be less flack from the staff to the students, and hopefully the students won't see the poor habits giving them false security that they can get away with improper techniques. The response was really cool from the Island Health employer to the PN educator. Her response was, now you're talking, I love this vision of safety culture, how do we get this movement started? So what I want to say is I guess our movement's going to continue in the workshop this afternoon, so thank you very much for giving us the opportunity to speak.